All right, everyone, welcome to the Strong Talks Online series. We're grateful to have Dr. Greg, who is a chiropractor, sports nutrition specialist, and strength and conditioning specialist. He's been in practice for 23 years, and he's also one of the owners of Osteo Strong Studio City, and he's going to be sharing with us solutions for lower back pain. I know I've been dealing with a lot of that now with a lot of sitting, etc. So great to have you here, Greg, and take it away.
Awesome. Thank you so much, Sarah. I really appreciate it. As Sarah mentioned, I am one of the co-owners of Osteo Strong Studio City, and I have a multidisciplinary practice in Studio City for about 23 years. Acupuncture, massage, chiropractic, teach rehab, and I'm a chiropractor. So we certainly see our amount of cases for low back pain, and we wanted to go over a few things today that can hopefully assist you and maybe where you are, and talk to you about things that you can do, and have a good assessment of yourself and make some changes. So if you can, I would love for you guys to have something to write on, because we're going to go over a few things. I might name some muscles and spell them out for you, so you can look them up on your own time, but just to have a better idea, a more in-depth idea of what I'm talking about. And we're going to go through a variety of things. So make some space for some exercise. We're going to be moving as well, some stretching, some strengthening, and sort of cover a large gamut. So at the end, I'm going to be open for any questions. I'm going to cover quite a bit of material and try not to go too deep, especially because that's sort of out of the scope of this call. But we're going to cover lots of things. So a few things I want to talk about before we even begin is I want to talk about some issues that may occur that are more of an emergency for back pain, and things that you should be aware of, either for yourself or family members or friends if they're describing these things. These are reasons that are a little more important for back pain and not your typical low back pain of just a little sprain, strain, or muscular issue. So I'm going to name about 5 or 6 things that are more emergencies that I just think that everybody should know about. And then we'll move more into common injuries and things like that we do with low back. So first off, if you have any bleeding in your urine, I know it's going to be kind of intense, any bleeding in your urine along with back pain, whether you're male or female. If it's a female, you could have a urinary tract infection. And we talk about this because we have reflexes from our internal organs that can go to our back. So you can have a urinary tract infection and have pretty deep, severe back pain and think that you just have back pain. So usually the urinary tract infection is causing the back pain, so you want to go straight to your MD, your gynecologist, whoever it is that you see as your medical professional to take care of that. For men, if you have much more flow, constant urination issues, and or some blood in your urine, we want to think about prostate issues. And prostate issues are very large in men, especially in the older population. And there's some swelling that can also cause some low back pain. So these are certain things we want to differentiate as we go along. There are a few more things we want to look at. When women have their cycle, you guys unfortunately get cramps. And cramps, uterine cramps, uterine muscles in uterus can also cause back pain, which is why they make dones for low back or Midol for low back pain for men people on their cycle. So these are just things to note that during that time, you may have some more muscular spasms and tension, and it's usually associated with your cycle if it's at that time. We also want to look at if you have any dark black stools as you go in the bathroom. That can also be an indication that you have some bleeding in your gastrointestinal tract higher up. And like I said, you can have some discomfort in your low back because we have a reflex we call a visceral somatic reflex. Visceral meaning your organs, somatic meaning musculoskeletal reflex. So if you have some problems in your abdomen, it can cause low back pain. So if you had really black, tarry type stool, then you want to go see the internal to your medical doctor for that. A couple more things, and this one's probably the most important. If you have unrelenting pain in the middle of the night, this is something you want to just be concerned with. If you wake up and you have really difficult pain in your back, it's not going away with different motions, whether you change positions, and it mostly happens at night. And these are concerns of some other deep pathology. You want to call your medical doctor, your orthopedist, your chiropractor, and talk to them about it. I refer you out because you want to do some special tests. Bone disorders, cancer, things like that show up that way. So when we have this type of deep pain, and it can also be deep pain during the day, that doesn't change with any position, and we want to start looking at things away from the spine and muscle. So those are things just to keep in mind, not to cause fear, but we should all be aware of these things because most of us don't know until it happens. Also, we are going to go into now some basic things that cause. So we have muscular pain, which is most common. We have disc pain, and I'll differentiate all these for you. We have what we call facet pain. I'll explain what that is. And then we have sacroiliac joint pain. These are the most common musculoskeletal injuries or pain that we have. One of 80% of us are going to have back pain in their life. This is the most common statistic there is. So today what we want to do is go over some things that can maybe decrease that potential for back pain, or prevent back pain from occurring, or if you've had back pain, some things you can do now which will help mitigate that pain from either getting worse or maybe have it go away. So we're going to go through a whole bunch of positions, and then we'll talk more about some things, and it'll become clearer. So number one, we're going to go down a list of things that right now you can do that if these issues are occurring in your life, you can make some changes. And there's going to be about 10 of them. So number one is our sleep position. Every year I'm on the news talking about sleep positions, biomechanics, and how it affects our body. And so this is something that we do, aside from most people's work, we do more than anything else. You may be there from 4 to 10 hours, hopefully you get more than 4 hours, but some people don't, of sleep at night. So positions and the way we sleep really make a big difference on our lumbar spine and our spinal health. So I'm going to go over a few positions that are actually really not good for you, that many of us do and have been doing since we're a child. And then ways to alleviate that or have better sleep positions. Now, don't be fooled that just because you've been doing it your whole life and you don't have any stress in your neck or your low back, that it's okay. Because this is the type of thing where as time goes on, these constant little minor stresses in your spine and ligaments and the adaptations of muscles changing, most of the time, of course, nothing is absolute, but I would say out of 23 years of practice, 99% of the time with this, it will catch up with you and you'll start to have some discomfort. And you won't always know what it is because you might relate it to other areas of your life that you're not really sure what's going on. But this is one of the things you can do right away, which will make a big difference. So I'm going to show you some positions that are common, but that are not advantageous to your spine at all. The most common is people sleeping, make sure you can see me, face down. Now this just was so comfortable as we were kids, and we lie down like this, or we lie down with our arms in this position, or a lot of athletes put their leg up and put their arms over here. So when we look at these positions, as I'm lying face down, and my head is turned like this, we can see that my spine is being torqued and gravity goes straight down. So gravity is putting compression on our lumbar spine, especially in this position. When we're here, it's putting pressure here, it's putting pressure up our neck. And so since many of us have been doing that for so many years, it seems so comfortable and we're going to be a little anxious about not being able to go to sleep. But I want to mitigate that by starting off the best we can on our side. Because it's usually easier to go from face down sleeping to side sleeping to possibly lying flat on your back with a pillow in your knees, which we'll talk about. So if we're on our side, we have our small pillow there, and we lie on our side here. We want to throw a nice pillow between our legs. And you'll see when I pull this pillow out, how my hip rolls. So now it's all this tension, all this muscular tension pooling. And if we sleep on one side most of the time, then we'll get an asymmetrical or a pool on one side that's not the same stress load on the other side. And eventually you can start having some discomfort. So we get a nice thick pillow, puts it there. You see how my hips stay stable? The arm is gonna be by your side. We wanna avoid having our arms up because it'll cause some shoulder and neck discomfort. When we have our head on the pillow, we can see this pillow actually fits me pretty good because my head's neutral. If the pillow is too thick, I'd be up here, and that puts tension all the way down the spine. If it's too thin or no pillow, now you see my head's rocking off the cliff here, and there's so much tension going down. When we're really young, we have enough flexibility in our neck to do those type of things, but typically as we get older, we lose some of that flexibility, and that causes some problems, and it'll start to pull. So if we can get to our side, that also mitigates when we're going to our belly, because we have a pillow here, it's harder to roll over because, and I would use a little bigger pillow than this, because things get in the way. You may kick that out in the middle of the night, but it's one transition that you want to start to. The ultimate position for sleeping in, which takes stress off your lumbar spine and your whole spine in general, is on your back with a little pillow on your knees in this position here. Hands can be relaxed, they can be by your side, heads up. We don't want your arms over your head. Although it's comfortable, it does put stress on the shoulders and also up near the neck. So we want to be mindful of that in this position. Certain angles here. And so this is a nice neutral position. So this would be very helpful. I probably see 20% of my patients that have changes in their sleep, which brings them in for neck and back pain, and they're not aware of it. So that's a significant amount of people. That's a lot of people. So causing those changes just right away starts to mitigate and also starts to retain some spinal health. The next thing we want to talk about is people sitting on wallets. Most gals do this, but a lot of guys do. They just take a big fat wall in the back pocket, sit down on their car or a chair, and the hip is inching up like this, pitches up, and that just puts tension from the bottom all the way up your spine, and it starts to shift your hips and your pelvis. So it's not uncommon to have people come in who have had pain for years, and you notice the back of their wallet. So if any of you guys are married, or boyfriends, or relationships, look at people's back pockets and you'll see this big area where it's been worn out from wearing that wallet. If they have, kindly ask them to stick it in the front pocket when they sit down, and that will take a lot of that stress out of that back. It's not uncommon for people to come in with had years of stress there. They take that out and within 2 weeks their back pain's on. And they're like, oh, it's magic. And I said, the only thing magical is you took the money from your back pocket to your front pocket. So try to be mindful of that. We want to look at our sitting positions. Now, sitting and posture are probably up there with 90% of the issues of low back pain. So we're going to look at a chair, a typical sitting position. And this is where I'm going to have you write down a couple of names of muscles. One is called the psoas, and we spell it P-S-O-A-S, psoas, P-S-O-A-S. And that's what we call a hip flexor. Hip flexor flexes our legs forward up. It's the strongest hip flexor muscle. In this position, that muscle, as it comes up, sorry about that, head run this because it's freezing in here. It's warmed up. So this muscle goes from here on your hip, and it goes straight through and attaches to your lumbar spine. And when we sit down in this position, which so many of us are at for work, computers, this position now shortens that muscle. It sort of contracts it. So if we're here for 1 hour, 2 hours, 4 hours, 8 hours, you know, what type of work you're doing, and so many people are on the computer now, that they're sitting in this position, and then you go to stand up. When we go from the sitting position to standing up, now it's pulling on that muscle, and it pulls your body and your back into extension. And that puts a lot of pressure back here. And you probably notice sometimes when you're sitting down and you go to get up, you're like, See, wait a second. See, wait a second. Let's relax. Okay, now I can go. So that is really indicative of these muscles being short. And when they're shortened like that, over time, it will cause a lot of constant low back pain. It's probably one of the most muscular components that are causing low back pain, aside from the muscles in the lumbar spine itself. So it's a biggie, and there's so many different tools out there now to stretch your psoas muscle. There's a lot of therapists out there that work with the psoas muscle, and so it's something I want you to look up. You'll see the anatomy of it a little bit clearer, and it'll make more sense. We go from this position to this position, how it pulls, and you'll see where it attaches on the spine. So there's the psoas muscle sitting, and then we also have the back of the legs. They're called the hamstring glutes. They flex the knee. So these muscles are also, as you can see, now short. When a muscle contracts, a joint shortens. So this is straight. As it contracts and comes in, it shortens. So when we're sitting for long periods, now we have this tight flexors, right, our psoas, and now we have our hamstrings that start to tighten up. And the hamstrings go from the back of the knee all the way to the bottom, just underneath your buttocks here. They attach to the bone. So when we stand up and they pull, they start to pull in the hips and rotate them back. This is a very, very common cause of back pain as well. So when we're sitting from here, we've got short hip flexors, short hamstrings. As we get up, these start to pull on here, this starts to pull in here, and it's very hard for us to get to this upright position when we're on good posture. So stretching the hamstrings, we'll go over this later, and your psoas are very, very important every time you get up from sitting if you've been there for a while. Same thing goes with driving. Some of us have to drive so much to get to work. Well, in LA, at least out here, the commute 5 miles could take 30 minutes, literally. In other areas of the country, it could take 4 minutes. But so if we're sitting in this position for a long time in our car, you can see how this hip is flexed, this hamstring shortened, and when we go to get out of the car, we end up having some discomfort. This is very important. So when we're sitting, it creates a lot of shortening of these muscles we want to work with. So these are the things that are important. One more thing with sitting that a lot of people do, and you'll see, is they do this. Hey guys, how you doing? Yeah, this is comfortable. This leg's over here. I go this way, not as comfortable for me. That tells me that I've done this quite a few times. So when we cross our legs over here, all this motion, just like when we were in the sleep position on our side, how it's pulled, it pulls asymmetrically or imbalanced on the low back and the spinal joints and the hip joints. So if you have to sit like this, which a lot of people do because they feel comfortable, my recommendation is you switch sides. So if you're like this for a while, make sure that you try to even it out like this. So there's an even pull on both sides. Just like sleeping, if you can, most people prefer to sleep on one side, but if you can swap sides, it helps you tremendously. So another thing that causes back pain very commonly is holding our kids, our children, especially our young ones. So it could be kids, it could be grandkids, but when we hold children, we hold them on one side typically. And I'm sure if there's any moms on here, you know what this looks like, right? You've shifted your hips over, you've got the weight of the baby sitting on the hip, but now we're creating all these changes in the back here. So it's shifted over, these muscles are contracting more, and I'm holding a baby. Or if we hold them up high, the opposite side, wherever we're putting a lot of weight, the opposite side of the low back starts to contract so we don't fall over. So if this was a 20-pound kid and I was carrying him like this, shift my hip naturally, obviously I have kids. But so that you don't fall over, these muscles over here have to contract and hold you up. So we create a muscular imbalance on one side of our low back. Remember what we said earlier is muscle moves bone. So if one side is getting more developed than the other, it starts to constantly tug, and eventually it pulls our spine out of alignment, puts some compression on the nerves, the muscles splint and tighten up, and we start to have some discomfort. So very important, young parents or grandparents, if you're holding your grandkids, that you switch sides. Very important. We all get comfortable, and your child is going to know when you switch sides because they're going to feel your dis-ease, your lack of ease with it. They're going to be a little squirmy, but you just got to practice and know that you're not going to drop them because it feels really awkward at first. Very important. Another thing that so many of us do is walking our dogs. In LA, especially here, there's tons of dog walking, right? So we have this dog, if they're not good on a lead, they're yanking us over, over, and over. God forbid there's a squirrel or there's an aggressive dog across the street or these type of things that are yanking. Most of the time, we walk our dog on one side. Either they're away from the street or they're away from the grass, so they're not stopping every 6 seconds. But that asymmetrical pull, again, is pulling us over, 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 keeps yanking us. That yanking starts to cause the muscles of the hips and low back to start to tighten up. So these things are really basic, but they're so common because most of it we do often. When I say often, it can be daily, it can be multiple times a day. So eliminating some of these things right away for most people takes away 80% of their back, literally. It's that basic, but we just forget to do it. So it's very, very, very important. So one of the things that we want to talk about again, one more thing is arthritis. This is another very, very common cause of back pain, spinal pain. And arthritis literally means, I'm not going to go deep into it, but it literally means inflammation of the joint. So you can look at some x-ray, you can see changes on the spine or other joints, but it doesn't mean they have pain. There's just some wear and tear changes. So if somebody tells you you have arthritis because they're reading something, that doesn't necessarily mean you're in pain or you're in trouble. When it becomes an issue, is typically people with arthritis, it's an overuse on a joint that occurs over and over and over, and years of degradation will change, and we start to have these changes. Because gravity is going down, we start to compress these joints too long, or if you've been doing the things that we spoke of, sleeping in those improper positions or sitting legs and torque positions for a long period of time, you can also cause arthritic changes with that. So I want to reiterate those basics are really, really important to really help stave those things off and keep spinal health as long as possible. So arthritic changes, usually we wake up with some discomfort in the morning and you get up and it feels really stiff, you know that, you go over and you're trying to brush your teeth or wash your face and it feels really stiff. This is more common in the population of 35 to 95. And then you start to move, now it's about an hour, so you're like, oh, my back feels great. And then at the end of the day, it might start to feel a little sore again. But most of the time, we wake up with it really sore because at night, we don't move so much. And joints that are inflamed or arthritic, some swelling occurs in those joints as we're sleeping. But because we're not moving, the swelling stays. When we get up in the morning, we try to stand up with compression, gravity. We start to get this deep ache across the back and we feel a little unstable. And as we move, the fluid starts to slowly move out of those joints. The muscles start to warm up and stop splinting so much. And that's why it starts to feel easier. Usually arthritic changes occur from some type of overuse, whether you're doing something repetitive overuse or we're holding bad postures for years and years and years. These things start to cause these changes. Multiple traumas, car accidents, sports, really sports that are more one-sided like tennis, or golf, people who do a lot of downhill running, those type of things create a lot of these changes. And we'll talk a little bit about that later. So lastly, we also want to look at a really common cause of back pain is our footwear. And so I'm going to take my shoe off here fast. So I want you guys to look at something underneath your shoes. If you have a little bit of stress, this is more common. When we have some pain in our hips, really common to have pain in our hips and our low back. So both these areas, our shoes, when we take them off, you can look underneath your shoe. And if you look at the bottoms of them, you'll see that maybe where your big toe is, and maybe where the outside of your heel is, if it looks like it's maybe a little more worn down than these areas, that tells us that as we walk, we're rolling our foot. So it's called pronation. The foot goes like this, lands and rolls. And so I'm going to show you what that does and how that affects your low back. It's very common. And one of the things you can do right away, if you've had some shoes that have been around a while that you love, I have a lot of patients with sort of their favorite shoes, whether they're clogs or heels or boots, and they walk, this foot rolls. As it rolls, it'll draw this knee in. As that knee goes in, these muscles have to contract to pull you back into position. Now you do this on this side, goes in, pull that. So all that puts a lot of tension and stress in the lumbar spine. If that's the case, if your shoes are worn out like that, then you need a new pair of runners, or you can go, if you have sort of nice shoes, fancy shoes, go to your local shoe store, shoe shop, a shoe repairman. It's like $15 or $20. And they'll cut off, they'll put a new heel on, and most of the time, at least 50 to 80% of your back pain will start to go away if that's the cause. So this is something you can just look at. This usually happens from imbalances in the muscularity in here. That's much more complex than we're doing today. But there's an exercise I'm going to give you to try to help build the arch. When you arch your feet, if you have flat feet, if they start to drop, that'll also cause you to walk that way. And you'll see, if you look in the mirror, your feet will drop in, your knees will move in just a little bit. That makes these muscles constantly under stress. So another thing we want to talk about here is water. Water, water, water. Your muscles are about 70% water. You dehydrate by even 3%. You get spasms, weakness, sometimes both. You couple that with an injury or some distress in these areas of your low back, then the muscle will splint even more, and we want to keep hydrated. Like I said, muscle moves bone. So if our muscles are tight and our joints can't move as well, and we start to lose flexibility, ligaments and our tendons start to adapt, then we start to have some long-term effects. So typically we take our body weight and we take 50% of that in ounces. So if I weighed, I'm just going to say 150 pounds, and then I took half, I would do 75 ounces a day. So just for people out there that have maybe high blood pressure issues, this is not something that you want to do at the end of the day where you realize, wow, I forgot to have my water today, and start drinking as much water as you can to make up for it. That increases your blood volume, which increases your blood pressure, and that wouldn't be a good sign. So drinking water all throughout the day is really important. You might have to go to the bathroom a little bit more, but your body will start to adapt to it, and you'll start to feel more fluid, looser, you'll wake up feeling better. Very, very important. So water, 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 water. If you're drinking caffeine, especially right now, so many people are sitting home so much inside, they're having more coffee than they normally would. They're feeling a little more tired because there's a lot of emotional distress. Coffee, tea, it's fine if you have a cup or two, but it's a diuretic. It makes you go to the bathroom. So for every cup of coffee, another cup of water, just to balance your system out. Lastly, and this is the biggest thing right now for what's going on with this pandemic, is emotional stress. So when we're feeling really tired, really stressed, really nervous, anxious, which is so common right now, we start to tug and hold our body. We hold this, see people hold their shoulders up like this. We see them holding like this. They're always walking around holding their backs. It's always tight. It's usually a combination of things, but right now, emotional distress is a big proponent of why we feel that tension. If you ever look back at a time, you may even be able to feel it right now, where you feel your stress is quite high, with a change in job or a change in moving or a change in relationship, these things, you start to notice more tension in the neck, start to notice more tension in the back. There's a direct relationship between that emotional distress and our physical distress, how we manifest ourselves, how we hold ourselves from our emotions really have a large factor in some of this pain. So if any of you are having a really difficult time right now, which a lot of you are, and you're feeling a lot of discomfort, and the idea of thinking about it makes you feel more tight, then you might want to just go online and look for some nice meditation apps right now. There's so many beautiful apps that aren't expensive or are free, or you can go online and do some visual imaging meditation and try to calm the system down. That type of stuff doesn't work. Meditation is very helpful. You might, if you have a therapist or you don't have a therapist, get a referral to one, because a lot of therapists right now are working remotely, and they can try to help you work with that stress, all the tension and anxiety that's going on with us, managing family's anxiety, our own anxiety. It's a lot. So these are the things that are really, really most important. So let's talk about muscular pain. Muscular pain of our lower back. This usually occurs from number one, we're dehydrated, not enough water nourishing those muscles. And we've been doing some type of repetitive exercise and movement for a long time. So it could be as simple as reach down and pick things up. And you'll see right now how I reach in different angles, right? And I have patients that come in that are CrossFit athletes, professional triathletes, that are dancers, that are moms, that are a 7-year-old golfer who reaches down to pick something up or tie their shoe, and they can't get up. And they come into me, and they're walking, and they say, I don't know what I did, doc, but it's just killing me back here, and all I do is try to tie my shoe. So this is a really common scenario. I went down to pick up my child. Instead of the proper way of going up and down, we're going at different angles. And most of the people, because of all the lists that I spoke about earlier, have some imbalances, muscular imbalances. So they go down and the muscles splint and they tighten up and they cause compression on the spine, and the spine has some activators in that cause the muscles to contract to splint that area and try to stabilize it. And it's compressing the spine and the joints, and there's some swelling and they can't move. So usually it's from dehydration, from a lack of training properly, and emotional stress. Those are the most basic things that happen. So the muscular pain will feel like, if you touch the muscles back here, you take your thumbs, you'll feel more on one side than the other. Muscular pain is usually consistent in that if you go and take a hot bath, it feels really good. I recommend Epsom salt baths if you can, EPSOM, it's a magnesium sulfate bath. For recovery, for training or exercise or feeling muscle spasms or just to de-stress. 3 times a week would be wonderful. So that kind of pain is more positional. You get up, you start to walk, and it's like, oh, it's painful in there. There's no pain in your leg, there's no pain wrapping around your abdomen, but you can just feel that it's really sore. That will typically start to reduce and go away after about 2 to 3 days. Hydrating, eating really well, try to eat your foods whole, natural, and healthy. Not a lot of processed foods, not a lot of sugar right now, because that also adds with inflammation in our system. We're going to try to keep inflammation down. So that's a really common thing. It's usually from some overuse associated with lack of eating and drinking properly and stress. Next, which you probably hear most people are most afraid of, is disc pain. Disc issues. So between our vertebrae, we have these little shock. They look like scallops, actually. And they act for compression. Every time we do this motion with gravity, you notice our spine has curves to allow for compression. Disc pain is very uncomfortable. This can also happen by bending down to pick something up. It's very common for people who are gardening and are moving pots. It sounds kind of silly, but it's very common. And athletes doing certain really aggressive movements can injure themselves. Traumas, like especially if you've had any car accidents, these type of things will cause some disc issues. Now, disc issues is a deep burning pain. They're typically on one side, but sometimes when you have disc injury, you'll start to feel pain from one side to the other a little bit. It's very hard. When you go from sitting is the most amount of pressure on a disc. So sitting is very uncomfortable. It gets worse and worse. When you go to stand up, it's hard. It starts to feel a little bit easier, but then as you walk, because of gravity, it starts to cause more pain again. Often, if a disc swells a little bit, it'll put some pressure on the nerves that exit the spine and come down the leg, the front or the back. You've all heard of sciatica. Everybody's afraid of sciatica. You don't need to be. So a nerve condition that causes discomfort, but many times it gets better. It just needs to be treated properly. You need to do specific things to take care of it. So We have the pain come down the back of the leg, and around here. That's typically your sciatic nerve. If you have pain that comes down and wraps around your thighs, it's called the femoral. That's a little higher up in the spine. Sciatica down below, femoral nerve just a little higher. Those are ways of differentiating between just purely a muscular problem, because it wouldn't slowly keep getting worse. And sitting down, when you take pressure off, it's only muscular. The muscle usually feels a little bit better when you take pressure off. But this, when you're sitting, is very painful. And this is something that we notice when we're driving, it'll get worse. It's sometimes it feels like it's unrelenting. You're constantly trying to massage yourself, but you can't get any help. So if you find that you've done something where you have this pain and then you start to have this really deep pain or pain shooting into your leg, and you go from sitting is very painful, and you go from sitting to standing, and you start to walk, if you can get up, that starts to get more painful as you walk. And often when we have a disc injury, we'll lift just a little bit. So we do that to take, because pressure is going down from gravity, to take pressure off the disc that's injured. So you'll see people walking or moving like this, saying my back's killing me. That's usually indicative of a disc issue, but not always. There are other things that cause it, but not always. So those are the telltale signs. We're going to go over an exercise now that's actually really helpful for this. It's called McKinsey. It's a physical therapy exercise, and we call it McKinsey exercise. And so try to influence that disc, and this is only if you're in this position. If you're in what we call an antalgic position. And you'll see standing, take pressure off. There's a couple things we can do. You come down, and we go face down. And from this position, we're going to just lift, if we can, to our elbows and try to soften our glutes, soften our low back. And you're going to feel some pressure in there. We're going to hold it for a moment. I want to come down. We're going to press back up for a moment and breathe. And come down. And we're going to do that 10 times. I'm going to press ourselves back to this position and try to stand up. If that doesn't cause any change, because you're still in this position when you get up, then a more advanced exercise for that, I'm going to switch sides for you. If I was standing like this, is you put your hand on the wall or a chair, or if you get out of your car, which commonly, if you have that disc injury, when you get out of your car, it's really uncomfortable because the seats in cars aren't the best ergonomic seats. Some people with their heater on the whole time, which causes a little more swelling. So when you get out of the car, you're going to put your hand against the wall, and you can do this at home or a chair. I want this arm locked. We'll take the opposite hand and we'll press into that pain a little bit and then come back just to neutral. It's a standing McKinsey exercise. Breathe into it, come back. You can do 10 of those, and then you'll stand up. You don't do the opposite side. So whatever side you're listed to is the side that goes against the wall or the car, and you press into it. You do that 3 times a day for 10 repetitions to try to get that disc and everything back up in this proper position. Because when we start to walk or have these conditions, over time, the other muscles, again, start to constrict, they start to cause spasm, and it puts more stress on other joints on the spine. So next, we're going to go to a very common, it's called a sacroiliac joint dysfunction, SI joint. And we want to discriminate this from a disc because a sacroiliac, which you can write down, SACROILIAC, sacroiliac joint. Also can cause really sharp pain in your back and into your glutes and in your hamstring. But an SI joint or sacroiliac joint issue, 99% of the time never goes below the knee. And it's usually only on one side. It doesn't switch back and forth. So this is most common when we go to pick something up, because when we've been sitting, as we went back to the beginning, our hamstrings are shortened and our hips are shortened. When we stand up, the hamstrings pull on the hip, which yanks the sacroiliac joint out of alignment. Causes a very sharp pain in there. And the difference between that, or the telltale sign in that disc is when you're sitting, you'll see people shifting a little bit. You might be uncomfortable. They go to get up, and it's like, whoa, that's really painful. It's hard to get up. But I noticed after about 10 to 20 seconds of moving, the pain goes away. In fact, people have sacroiliac joint issues, and they'll go run a 5K or a 10K because when there's motion in there, the fluid in that joint moves out of it. So that's very important to distinguish between that and a disc issue. It's much less, it can be as equally as uncomfortable, but it's less significant clinically, unless it's chronic going on for years and years. And it's very hard to treat. Ice is usually your very best friend for a disc and a sacroiliac joint. So if you find that you have either of these things that we're talking about, you want to ice initially, especially for about 20 minutes on, 20 minutes off, 20 on, 20 off. Do 3 rounds of that. Do that twice a day, and that'll help significantly draw the swelling down. Always want to control the inflammation, which allows the muscles to start to calm down, to stress off the nerve roots, and the body starts to get back to homeostasis. So sacroiliac joint, SI or SI joint. You can look that up. Really common. People who've been sitting for a long time and they get up and they have these shortening imbalances. They go to pick something up and they feel a sharp pain on one side. Those are the most common. We also have what's called a facet joint. Facet imbrication or facet joint. F-A-C-E-T. F-A-C-E-T. Look that up as well. Those are interlocking joints in your spine. So we have your disc between, and then we have joints that interlock like this. They go in between. And when we have these imbalances, muscular imbalances, and we start to tug and pull on each side, it puts compression. Now, facet problems occur very commonly with short hip flexors or short psoas muscles. Because when we go to stand up, we start to do this because we're hyperextending and the psoas is tight. And when that happens, when we hyperextend, it compresses those facet joints. And this is common. You get a band-like pain across the back. It doesn't shoot down the legs. The muscles associated with it might cause a little irritation here, but it's usually straight across the back. It's a very deep, dull ache. It's very uncomfortable. When we're sitting, we shift a lot. It's uncomfortable. As we move, though, many times it gets a little easier. When we have a facet problem, when we bend a little bit forward, it takes the pressure off and it feels really good because it gaps that joint. These are indications that you have a facet problem. These are much more common. These pull the spine out of alignment. They put some pressure on those joints. The muscles are constantly splinting. This happens when people train, and they train areas more than others. They train their quads more than their hamstrings. They train their core, but they never train their low back part of it. And so we have these muscular imbalances that cause facet problems. There's also sports that are really common that cause this. So we have tennis, which is a unilateral sport. So as we step forward on the forehand, this, as we're going forward and follow through, this side contracts, the muscle moves forward and puts stress on those facet. Golfers, as they swing through, they do a lot of rotation and extension, which compresses those facet joints. So most unilateral or one-sided sports, if we don't train properly off season or do some basic stuff during the season, we end up having back pain or hip pain, things like that. So really, really, really important. I know I've gone through a lot of stuff, so let's start some stretches, some basic stretches. I'm going to talk about a few things. When we're sitting, like so many of us do, which you guys might be doing right now, and we go to get up, and those hamstrings are tight. If you can remember this, if you have a job where you're on a computer or you're on the computer all day, when you stand up, you can bring this leg up and just let that hamstring stretch. You're going to hold it for about 20 seconds. Nice and easy breathe. If it's too hard to do that, you need your knee bent a little bit. That's fine too. You know, do both sides. Always stay symmetrical on both sides. And then you can also bend into it. You don't hold that. Very, very important. So we want to stretch these hamstrings. A lot of times, the shortened muscle is also a weak muscle. That's why you usually see your physical therapist or your personal trainer, you might see a yoga or Pilates teacher, you might go to your chiropractor your teachers recently have. But most of the time, these short muscles, if they haven't been traumatized from some type of injury, they're a little bit weaker. So a lot of people feel like if they exercise or lift weights, that they're going to get tighter. Many times, people who lift get more flexible. In fact, people who lift quite heavy, if you look at powerlifters, CrossFit athletes, they're squatting and their hips and their knees and everything, although it's difficult on the joints, they get a lot more flexibility because they're going through deeper ranges of motion and they're getting a lot of muscular strength and balance. So we want to really keep in mind that training and strength training, balance, and flexibility are all really important for a lumbar spine and full spinal. So when we get up, if you're in your car for a long time, you get up, put your foot on your bumper, both sides. If you're sitting in your chair like this, you get up and want you to stretch that. Make that something you do multiple times a day. And this is something, especially if you're feeling some tension in the low back or you don't already have a stretching routine. If you have a really consistent stretching routine, then you might do this less often in the chair. But these are also things we want to do. We also want to do sort of a lunge stretch. Now, we want to do this, and we're going to use the chair to help us so we don't feel unstable like we fall. And we're going to go into this nice, easy suicide. And so we're just going to sit back into this a little bit here and let this open up. So this is our hip flexor, right? Part of the psoas. And we're just going to sit into it a little bit. If this bothers your knee on the floor, you're welcome to bring that up and use your arm on here and it'll drop down. We want to try to keep our hips straight. We don't want to rotate. In this position, we don't want to do this. We want to try to keep everything aligned. So we either start down here if that's easier for you, and just feel a little stretch. You're just going to hold that and breathe. Again, for about 20 seconds, and we'll do it multiple times. So it takes at least 6-7 seconds to get over what we call a stretch reflex. So your body won't start to let go right away. So that's why you're going to hold it long. If you have difficulty with balance, it's a lot easier on your knee. If this is hard on your knee, you can put a pad or a pillow or something on the floor, which might make it easier. If not, you can sit up and sit into it in this position. Now, some of you might get up from that and go, oh, it feels a little stressful in the low back. That's because that muscle has been really short, and as we're pulling on it, it's pulling a little on the spine. So you want to do a little less stretch, a little more consistent with that stretch, and that'll start to go away and take pressure off those we call set joints. And that's to open the psoas muscle up and the hip flexors in here. Everything we're doing is shortening. We want to do what's also called quad stretch. So when we're in this position, we grab a chair, go here. Most of us can do this all day. Some of us can. If you've had a knee injury or knee surgery, it's very difficult. But what we would do with this is draw that back. As we draw this back, it stretches the quads, but also some of the hip flexion muscles that come across. One of your quadricep muscles, called the rectus femoris, crosses this joint and assists with it. So when we do a lot of quad work, we're training or we're sitting a lot, and it's a shortening, we want to make sure that we then start to open this up. So always, if you can, unless you feel okay without it, always use a chair to balance and just pull that. And again, you're going to do multiple times on both legs for about 20 seconds. So 2 times each side. Super helpful. These are also really nice stretches to do prior to going to sleep. Open your body up a little bit, increase some circulation, and decrease muscle tension before you sleep. You'll have a better night's sleep. Next, we're going to go into some glute stretches for our butt muscles. I want to just come back to one other thing that's a little bit, there's something I want to talk to you about for a moment, and not to be too confusing. Remember at the beginning, we talked about your foot rolls, you're pronating, your knee goes in, this contracts. There's a muscle here called the gluteus minimus. Gluteus, G-L-U-T-U-S, minimus, M-I-N-I-M-I-S, minimus. Look that up. There's a trigger point that will occur if that's overused. It's also very, very common in golfers who tweaking and torquing. That can cause pain down the leg. That and your piriformis muscle, your hip extensor, can cause pain down the leg. So we can have pain down our leg that isn't disc-oriented, that isn't from our sacroiliac joint. It's not from our facets, but it's from these muscles. And those are usually overuse injuries. And so when that happens, you'll get this dull, like, tingling, not a sharp pain, not a burning pain. This is dull ache that keeps going down your leg. And that's when we have what's called a trigger point in those muscles. That happens from these imbalances. And when you're walking like this, overemphasizing, of course, for a long time, you use shoes, you have bad footwear, you can start to have these. Some people automatically assume if they have pain down their leg, and they can go all the way down to the lateral side of the ankle, that they have sciatica. It doesn't, because when you sit down with it or lay down, usually if you're laying on the opposite side, the pain is much less. With those two, if you sit on or put pressure on those muscles, or you push on them, they're really tender, really sensitive, and they'll cause a little bit of that discomfort as well. So for that, it's very helpful to do this neck stretch, as well as hot Epsom salt baths, because you want to try to get those muscles to relax. Okay. So this is a very basic, and many of you know this, and some of you don't, stretch. We call it thread the needle, and it's for your butt muscles. So you'll bend one knee, bring the other leg up if you can there. For some of you, this might be all you need, and you feel a stretch on this right side. And then we can bring our hands through to grab this, and we pull this in. And as we pull that in, then as I reach through and I pull this across, it'll stretch this very well. And again, you're going to hold. If it's more comfortable for you to head down because it's too hard for you to use the neck muscles, you can put a pillow on your head to get it to relax, and then pull this up. For many people, as we switch side, they get a better stretch when they bring their upper body up a little bit as they pull it. Now, if you're doing this and you find that one side is much tighter than the other, then you know you have an imbalance in there. And it's something for you to note about yourself and you start working. Thinking, how did I create that imbalance? I should do this stretch a little more often now. You want to take care of that. Very, very, very important. So with glute stretches, that's the most basic. There's many more, but those are the most basic. That hamstring is a very important stretch. And you also want to stretch hip flexors. So we went through some basic ones that are really important to do daily. We're going to go through a little bit of strength as well now, which is really, really quite important. Take a breather. We're going to start with strengthening the posterior or the back side, because many times we have back pain because of lack of muscle strength, lack of muscle endurance, and all these things are incorporated together. So we want to add strength and conditioning. Very, very important. This is some basic strength and conditioning for our core area and our lumbar spine. And there's a few, we're just going to go over like 3 different exercises to get you started. If some of you guys want more advanced stuff, please feel free to email myself or Sarah, who has graciously hosted this event for us. And I can come back on and we can get much more detailed and more specific. But for right now, we're going to stay really basic. So we're going to do what's called a bridge. And a bridge, we lie on our back. Our hands are on the floor. And the first thing we're going to do is we want the pressure on our heels. I don't need your feet up, but I don't want you to push off your toes when we do this. Our hands are down. And slowly lift our hips up. Now, you can see that my thighs and my abdomen are in one point. We don't want to go higher than that. We don't need to go much higher than that because it starts to cause a little compression in the spine. So from here, we just go straight up towards in that position. If you can't get that high, you want to go to there, that's fine. And we really want to focus on trying to really squeeze our glutes, squeeze our butt muscles. So we pull that for kind of 5, 4, 3, 2, 1. And we'll get it nice and easy. We'll bring it back up. And pull that up for 5, 4, 3, 2, 1. Really squeeze and let it down. We're going to do that, or you're going to do that, a set of 5 of those for 5 seconds. 5 of them, like that, for 5 seconds. The next exercise in this position is, instead of pulling this up here, we're going to pull our abdomen into the ground. We release. You see I'm pulling this down into the ground. So it recruits our lower abdomen. Let that relax. Pull that down in. Hold. 5, 4, 3, 2, 1. Let those hips go. Rotate that back down. Press that into the ground. 5, 4, 3, 2, 1. And release. We're going to do 5 sets of 5 seconds of that too. So 5 seconds on, 5 off. 5 seconds on, 5 off. So if those are too easy for you, you can stick one leg up in the air, this foot flat, and do a bridge with a single leg. Hands are down. And so we can hold that, squeezing in there, pushing off your heel. Your hamstrings recruit a lot in this as well. That whole posterior or back side of our chain, straight up to the sky, and you'll hold that for 5, 4, 3, 2, 1. Lie down, breathe, and again, you'll press straight up. You want to keep this flat. This is what I don't want. I don't want you torquing this way. This stays flat, not like this, okay? If you find your hip shifting out, it's because you're not using the glute muscle. And really important, in the lumbar, low back stabilization is having strong glutes, strong butt muscles. So, back to single leg. Again, we go straight up. You hold for 5, 4, 3, 2, 1, and let it down. If that's what you need to do because the other is too basic, then you swap sides, and I want you to do 20 repetitions, 2 sets, and do those 3 days a week. Much more difficult. Next, we're going to go to a plank. And the plank is the deep intrinsic muscles of the abdomen, works your transverse abdominis muscles, works your rectus abdominis muscles. And so there are many different forms and styles of this, but we're going to start off really basic, and we'll do one that's a little more advanced. But we're not going to go too deep into it. That's out of the scope of this call. We're going to start this plank on our elbows and our feet and our knees. And so you walk yourself down. If there's discomfort on your knees because of this, then I want you to take a pillow on your knees. Not a problem at all. Walk yourself down so you go safe to your elbows. And we keep this nice and flat. And again, we're trying to pull through our belly button up towards the sky. We hold this. I don't want your head extension. Try not to let your back arch like this. Try not to be up too high like this, your head below. Try to just keep a nice neutral plane. So your eyes are pretty much looking at your hands or your thumb. The body stays flat and you pull straight up through your spine, through your abdomen. It's like there's a string coming through you, pulling you to the sky. For this position, you will hold for 10 seconds. You can count backwards. It's usually easier. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And then you can relax for a moment. That might put a little stress on your shoulders. Shoulders might not be strong enough, but they will gradually get stronger with this as well. If that's easy for you, then we go from this triangle. We lift our legs. We hold the plank here. And again, same positioning. We're holding tight, pulling straight up through the spine, through the abdomen. You're going to hold this position. Neutral, tight. 5, 4, 3, 2, 1. Relax. And then you go back to that position. We do 4 rounds of that, which is really great. Then we're going to go a little more advanced with this. So when we go from our plank, we can go straight, and then we can drop one side down and up. The other side down and up. The other side down and up. And what this does is it works on our rotational muscles, our oblique muscles. Very, very important move. Not easy to do. It's more of an advanced move. You have to move from elbows to straight. After you've been doing the straight plank for, say, 6-8 weeks, then I would add some simple rotation. This is what it looks like. From here, we roll to the side a little bit, we come up, pull, roll to the side a little bit, up, pull, roll to the side a little bit, up, pull. And you may start off with 5 rotations, and work your way to 10 rotations, and 20 rotations. You'll feel all these muscles engaging. Because we don't only want to strengthen the abdomen and the low back, we also want to strengthen the glutes. So all these areas are really critical for low back and spinal health. Got that? So we're going to go one more exercise. And again, this is for your lumbar spine, the lumbar musculature, we call perispinal muscles, or occipitalis muscles, or rotator muscles. You can look these up if you look up paraspinal, P-A-R-A-S-P-I-N-A-L, muscles. It'll teach you about those different ones I was just talking about anatomy. But we're going to do what's called a Superman, bird dog, Superwoman, we'll call them different things. We're going to have all 4 in this position here. Now, for some people, again, this is difficult. You put some pads on your knees. And we're going to lift just one arm up and down. The other arm up and down. And when we do this, it changes as we go from this position, head's neutral, lift one arm up. So now I've changed my base of support and down. This arm up and down. So my core has to contract. And as I'm bringing that up, the muscles in my back are contracting. So it's a very good stabilization, balancing exercise. And we're going to go from there to left leg up and down, right leg up and down. Left leg up, squeeze, and making sure when you bring it up, you squeeze your glute and down, right leg up and down. After we go through all 4 quadrants, right, left, then we start to do multiple things at once. We go from right arm and left leg, and we fold. Try not to do this too much, but you'll see that in one position, and we're going to go left arm, right leg. And with this, I prefer your thumbs up because it takes stress off the shoulder girdle. This position. We don't want too much swaying here. We want to try to keep neutral. And switch. Right arm, left leg. Hold that straight line like you're reaching your feet and arms out, and then back down. I'm going to do 4 rounds of that with 5 repetitions each. So we go 1, 2, 3, 4, 5, and relax. And then 1, 2, 3, 4, 5, and then relax. In between, when I say relax, we're going to go into a stretch called child's pose. If you can do this with your knees. This is just a nice, easy stretch down. And this is a resting position in yoga. So people just let their body stretch and elongate these muscles. So we increase strength and flexibility at the same time. So that's what we're going to end with those exercises. There's many variations of this. We go up on all 4, and then we start to lift in this direction. And so when you have those type of really strong core and balancing, that's a much more advanced move, but that's where that goes. So right now, we want some bridges. We want to go through our tucking. We want to go through our planking. We want to do some Supermans. And then we want to end with a really nice, open, relaxed position, child's. If we can't go there and you can just do this, that's fine too. We've had some knee surgeries. It's hard for you to go in that position, then we can go from a chair. And we can just bend down here. Just rest. Just rest. Just let this open up, and eventually your body is going to relax down. come up. So I think we'll end there because we'll do a lot of information today. Keep your hydration up, sleep properly, eat well, think of your posture. If you're having a lot of distress and anxiety at this time, my recommendation is to try to figure out some type of movement meditation, or which is really great for yoga, like a vinyasa flow yoga, which constantly moves, but it's great for flexibility and strength. We might go online and look for some guided meditation. If that's also really not keeping it for you, your mind's just spinning, you might seek out some advice to a therapist. They might give you some better tools that you can work with, whatever your specific circumstances may be. And that's it. So grateful to have you guys here. Like I said, this is Dr. Greg from Studio City, the co-owner of Osteo Strong Studio City. We're here to help. We love our community. We want to teach about the basics of health, fitness, and longevity, and anything we do, just let us know. God bless you all, and I hope you guys have a beautiful, beautiful question for me. I would love to hear some questions.
Thanks so much. That was so helpful.
Thank you, Abby.
No, it was Diane.
I can't see who's on there. I saw Abby's face. I can't tell you. I know that was a long time, but I thought it would be nice. Anybody have questions? If you don't have any questions, that's fine too. I wish you a beautiful day, and that's it. You're welcome,
I have
Adrian.
a question.
Yes.
My lower back, this is Linda.
Yeah.
My lower back has been bothering me, and I've been indoors and I've stopped walking. Should I just take up walking again?
100%. Yeah, movement is really important. Now, all joints. If you were to hold your hand like this for an hour, it would be hard for you to peel those fingers off. Same thing happens with our lumbar spine, our hips. Motion is really going to give us the most longevity in all of our joints. Yeah, it creates increase in circulation. It decreases inflammation. Gets the muscles to activate. Yeah, very, very important. Good question.
Thank you.
Yeah, that's happening to so many of us now who are sitting home. They're kind of being sedentary, right? And so we want motion. When it stops raining, if you walk your neighborhood, unless you don't mind walking in the rain with an umbrella, that's fine too. It'll be good for you. Yeah.
Thank you.
You're welcome.
Yeah, Dr. Greg.
Anybody else?
I don't know if you can hear me, but I just want to say thank you. That was dope. And thanks for doing it, man.
Oh, right on, brother.
Hold on. Question.
I recognize that face. Hey, Nick.
Hey, bro.
That's my pleasure. My pleasure.
Your strong place looks amazing. I need to come through and see that after all this craziness is done.
I'd love for you to come by. We love our facility and we help a lot of people here. So thank you, man.
Balance.
Okay, hang on. We have a question.
We have a lady in the balcony. One of
Change
the
hair color, lady in the balcony.
yeah, one of the problems I have with the stenosis is balance. Is there things I find that I'm off balance so much?
Yeah, so this happens when we have stenosis. Stenosis literally means a narrowing of. And so when people have stenosis in the lumbar spine, there's compression on the nerves. And with that, the nerves can't fire properly the muscles, so we start to lose balance. So we want to be mindful when we have stenosis not to do a lot of extension work, because that causes that compression on the nerve roots and will activate the stenosis. So with balance, there are a lot of exercises we could do for balance, and especially when I was on all fours there and stabilizing with each opposite hand, opposite leg. If you have stenosis, you can do that exercise, and you can even do the exercise where you're going cross crawl, but you want to make sure that you don't, when we come here, that we don't hyperextend, that we just stay straight out. A lot of times when people have stenosis, they start to use their glute or butt muscles less because they're not extending and putting pressure there. So we want to activate those. So you might even be doing this motion instead of coming all the way out, all the way up, you might even just come to here and this motion here to get this activated and strong. So as we stand, when we have weak glute muscles, when we walk, our hips will shift and we lose balance. One of the things we do on the vibe plate here, but I'll show you on this chair, is we're gonna lift one leg, holding onto the chair, and you'll see that if I lift this leg and my hip shifts out, it's because I can stand like that, but I'm not using my butt muscles at all. We wanna shift that in and get that tight so we're holding this straight line. You need to hold on, so I want you to do that for 10 seconds, and then if you go to one finger or let go, I want you to hold that. Then I want you to switch sides. Again, if you see your hip shifting, you're not using your glute. You want this to come in and hold. Really, really critical for balance. I also would recommend that you do this barefoot. And the reason why is because with these balance issues, we stop using, again, if we're wearing really thick shoes to comfort our feet, we stop to use the muscles in our feet and the arch muscles. So I want you to think about when you're in this position, how your feet are pushing and your toes are pushing on the floor. You want to start developing the musculature underneath there as well as your hip. So we don't trip and fall, because falling is fracture prevention. We want to prevent fractures. One of the reasons why we want all the strength and stability here. So those are two things you could do right away. There's much more advanced stuff with balance. If you're an OsteoStrong member, you probably remember what we have in the biplane, which is all about balance. But I also did a YouTube video with balance. If you look me up, Dr. Greg Van Vicaris on there, there's a balance video that's about 10 minutes long. It's all different things you can do for balance, starting from here to basic, to band work, to really check the core. And I think if you haven't seen that and you go on, it'd be really helpful for you.
Yeah, no, thank you. I'll check that out because
Of course.
That's a major issue and keeps you walking tentatively.
Yes, yeah, for sure. But I think that go a lot more in detail there. I think would be really helpful for you. Both of you can both practice. We can all use it.
Hey, Dr. Greg, you know, you're talking about the sitting down for a long time, and a lot of us are sitting down, and obviously we're our computers or we're trying to work or etc. Sometimes I've been noticing it's like a dull ache sometimes, and is that to do with what you've been mentioning? Just making sure you're doing the stretches after you've been sitting for a long time.
You notice don't like while you're sitting or when you get up?
Like after, like it's been like say an hour or two, and I'm editing, and then I start to really like the lower back starts to get that's the dull ache I feel.
Yeah, so a lot of that has to do with the muscles adapting and shortening and starting to tug. And also, you want to be mindful of your position. If you're editing, a lot of people, when you're into your edits, you start to forget about how you are. You start to this, looking right now in these positions, which tax those muscles. If those muscles are tired, and if you're not hydrating enough, they'll start to ache like that. You get up, move around a little bit, stretch the hip flexors and your hamstrings, then go back to it. That'll help a lot.
Yeah, because I find myself doing this otherwise, like trying to lean forward off of it and like keep a flat back and then work like this. It's like, no, I can't. I need to stretch in between.
And especially going forward, your neck's going to start getting tight because the bowling ball of your head, 8 to 10 pounds, is being shifted over there. And so you want to try to step a little bit more. I don't know, are you working on multiple screens or just one screen?
No, just one screen at the moment. Yeah.
Okay, good.
All right. Thanks, dude.
Sometimes people who edit on multiple screens they're always doing this instead of a swivel chair. So that's why I'm
actually moving to that.
Yeah.
Thanks, dude.
Anybody else? Ready to go enjoy this rainy day?
Thank you. Yeah.
Thank you so much, Dr. Greg. Appreciate you.
You're welcome. It's my pleasure. I just love trying to help people any way we can. So
The place looks great.
Yeah, can't wait to visit you once we can get out.
you can see it.
Like November.
Look at that, dude. It looks awesome.
Yeah, it's cool.
How
Great
long
spot.
has that one been open?
Since last, so 6 months, 7 months.
Really? Well, I didn't know. Okay.
Diane, we can go on a field trip together and maybe get a few of the Ovarian Cancer Circle Foundation folks from over there to meet us.
Yes, absolutely. Absolutely. I didn't know. I don't know how I didn't know, but Sarah will tell you, I'm just like such an advocate of OsteoStrong, and I'm going to.
Oh, good.
I'll let lots of people know because I know so many people in the valley. So, and whenever I mention it, well, they're not coming down to the marina. I get it. So that's great.
No, that would be wonderful, especially if you were talking about post-cancer patients, meds, leach our bones, calcium and osteoporosis becomes
Oh yeah, no, Sarah knows I'm one of the great success stories of OsteoStrong.
That's so awesome.
Glad, yeah, for sharing that.
Yeah.
And thank you for sharing Maui behind you. I mean, surfer, so I would love to. Can't wait till I get back on a plane and hit some waves.
Yeah. These virtual backgrounds are so awesome. I love it.
Yeah, it's funny.
All right, everyone, have a great day.
Beautiful day, you guys, and thank you for your time.
Thank you so much. Thank you so
Thank
much.
you.
Thank you, Dr.